What's happening in the canine industry? For all the latest news, views, and expert opinions, stay right here for the Canine Paradigm. You'll hear from industry leaders, experts, doyens of the industry, learned colleagues, movers and shakers, and the odd randy guest. Get the latest insights and expert advice from both here and abroad from the people in the know. Now, here are your hosts, Glenn Cook and Pat Stewart. And I'm Lofty Fulton, and I'm out of here.
Glenda?
Yes.
We have to do a new ad.
We do.
It's a solemn time. Our long-time sponsor of the show, George Kittredge,
Yes.
very, very sadly passed away. And we formerly used to advertise for him his Rowdy Hound boxes.
We did.
So we don't actually know what's happened with Rowdy Hound boxes. You know anything about that?
I looked at the website. It said that they're recalibrating since their founder and boss has passed. But nonetheless, I think that you and I want to honour the memory of George
Yes.
Kittredge anyway. He was a friend to both of us, a hell of a good guy, and he supported us almost immediately. He was on board through and through, and I just don't want any of us to forget George. He was a terrific human being.
So we intend to continue to advertise Rowdy Hound, even though we don't know what's going on with them.
Yep.
In the hopes that they keep going, and that can be a bit of George's legacy that we're able to continue to promote.
I hope so.
In checking it out, we had a look to see, because we're not real good with the sponsorship. So we had a look to see who's actually paying for sponsorship. And we have a list of people to tell you that we support. And the first is our sugar mama, Barbara de Groot.
She's been with us from the start as well. Barbara's been an absolute staple in our...
She's a gem.
She is a gem.
She has a business.
She does. From the Heart Dog Training.
From the Heart Dog Training.
Yeah.
You can check it out. But she supports us as much and more than anybody ever has. So we appreciate you very much, Barbara. Another person who's supported us from the start,
The Einzelwiener.
Einzelwiener.
The Bullfed.
The Bullfed.
Yep.
It's where I get all my stuff.
Yeah.
It is, truly. It's where I get all my dog gear. If I need something, Jason's my first point of call. I don't use his shit website. He has a website. It's dog shit. I just message him directly. You guys probably should use his shit website, but I don't.
Yeah, because you don't want to message him directly and get his grumpy ire of the day.
Yeah, but do it. Get all your dog stuff from Jason. He's got everything you need. He's got all the shit that you need to train a dog for realty.
Everybody who comes to seminars and looks at mills and asks me mills questions, ask Jason.
Yeah.
Jason can point you in the right direction for getting the mill that's best suited for you.
I really like his leashes. I'm a big fan of his leash pack. That's why I sort of convinced him to do it. But anyway, get your stuff from Einzelwiener.
Yep.
Do you know who has a fantastic website and ships internationally?
My wife?
Your wife,
Yeah.
Canine Paradigm.
I couldn't imagine her not having a good website, how much of a perfectionist she is.
Well, the products are amazing. My dog merely being alive is a walking testimonial to that. My dog, who I've retired numerous times and has come out of retirement when I've managed to get his body back to healthy, and a big part of that is related to Canine Paradigm. So check it out, everybody.
I could say so many nice and biased things about Canine Paradigm and my wife, but what I will say is ignore me. Just look at testimonials. The testimonials speak for themselves. That's where the field trials are working. What makes Narelle's day, and mine as well, is when people are emailing in and sending messages of, well, primarily people have had no hope in the past because just everything that they were trying wasn't working, and now it is. And that is the testament that something is actually really working. And the other thing which I will add, one of the things that Narelle's told me in the past is dogs are incapable of understanding the placebo effect.
Oh, that's a good point.
So you can fake it on a human, but you can't fake it on a dog.
I never thought about that before. That's actually a really good point.
Well, my wife's actually a very smart person.
There you go.
So she's told me that humans are subject to the placebo effect where dogs are not. So it either works or it doesn't on dogs.
There you go. That makes total sense.
Yep.
There's one other person who puts a fair amount of work into this show.
Yeah.
It's me.
Yeah. Funny about that.
And I have a digital product that you can buy. If you go to my website, seriousdogbusiness.com, right now I've got 2 courses available to you. The Overview, which is a small course where you could learn how I teach.
Yep.
But the other one is the Wave Tops, which is a bigger course. It's everything I know about dog training. Well, it's not everything. It's a lot of what I know about dog training.
Yeah,
check it out.
terrific. Yeah.
$500 dues. That's all it's going to cost you.
I recommend it when people are saying, what do I do? How do I get in the industry? I recommend them to your course.
Oh, wonderful. Thanks,
Yeah.
sir. All right, on with the show. Welcome back to the Canine Paradigm. I'm your host, Pat Stewart. I'm joined in studio today by my co-host, Glenn Cook. And today we have a very special guest in the studio with us, and it's our second in a row of having someone in the studio.
It is. Amazing.
It's Neil Barnsley from Animal Holistic Therapies, who we have spoken about many times on the show.
Many times.
All of our dogs are patients of his. Welcome to the show, Neil.
Thank you.
I was about to say, if you don't know who Neil Barnsley is, who the hell are you?
Yeah, go back and listen to some episodes of us talking about him.
Exactly.
Yeah. Let's give your intro, Neil. So thank you for making the time to come out and talk with us. I won't give you a history. We want you to do that. But to give some context, you have treated Glenn's dog, Ladybug, who we've gone through in great detail in the past about how she broke her back and was completely paralyzed and is now not.
Yeah.
My old man that has every injury he can possibly get himself, he manages to get. And actually, I was just mentioning, I was training with people today and said, I've got to go. We're doing a podcast with Neil. And more than, I'd say 2/3 of my club have had dogs come out to see you. And everyone's like,
great.
oh, cool. That'd be great. Tell us, what is it you do? What is your job?
I kind of think about it like I'm a canine injury specialist. I've dedicated my career to specialize in the treatment of injuries and arthritic conditions that can affect dogs' well-being and their ability to get around. I kind of see myself working in an area where veterinarians don't typically work in. So if you go to your veterinarian, they typically have two ways of treating an issue. They have surgery as your main option if nothing else works, or anti-inflammatories or medication. If the issue that we're seeing doesn't fit into either of those two categories, or they've tried those categories and they're not actually helpful, then that's all there is for that particular case. And a lot of cases, it's like, well, we've tried, that's all we've got. So I work in that grey area where people have kind of either been frustrated, where they just can't find any other solutions, or they're looking for other solutions that doesn't involve surgery or medication. I do that with the use of alternative treatments, including acupuncture, infrared laser therapy, Chinese herbal medicine, and chiropractic techniques. And with those methods, we're able to get some pretty amazing results, ranging from helping a dog that's been chronically lame for months into years on end, all the way through to dogs that have been suffering from chronic back pain, spinal injuries, all the way through to paralysis. As you would know, Glenn, when we're dealing with a dog that's paralyzed, there's very little options for them. So in that field, that's kind of where I specialize, and that's where my passion is. If we've got an issue where a dog has been paralyzed from a spinal injury, they respond extremely well to the combination of the treatments that we do. And in most cases, we can get them back walking and having a relatively normal life within about 8 to 12 weeks.
So you're a third generation in this, aren't you? Your grandfather and father were involved in holistic animal therapies as well.
Yeah,
So
absolutely.
tell us about that, because that was interesting. But I know you and I have spoken about that on visits that we've had in the past with Ladybug. Tell us more about that. Like, how did your grandfather get into it? What did he do? And then how did he pass the mantle to your father? And how did that get passed on to you?
So my grandfather, William Burns, he moved to Australia from England. He was a registered and practicing human chiropractor and acupuncturist coming from the UK. And he was working on humans mostly in Milperra and Panania sort of area in the outer skirts of Sydney, but saw that there was a need for something for the animal world. He always had an affinity for animals and saw that there wasn't really a lot of techniques that were available or treatment options for the animal world. So started devising some methods and techniques that were usable for canines and horses. And the main part of the treatment protocol was essentially for racing animals to start with. So thoroughbreds, racehorses in the harness racing world, and racing greyhounds, because racing greyhounds was a bit of an industry back then. It's
taken a hit lately.
It's taken a hit recently, but back then it was pretty popular, particularly with the Aussie battlers that were out there just having a go. So he was very popular in that sort of industry and was doing fairly well. At the same time, still seeing multiple humans, seeing a lot of sporting groups, football players and so forth, and treating both ends. Then my mother met my father, because this is my grandfather on my mother's side.
Right.
So it's not actually my father's father.
Yeah, okay.
Then my dad met my mother, and they were relatively young, about 18, 19. By that point, Dad was a mechanical engineer, very, very intelligent, and was already teaching in the TAFEs, all his craft. And he was kind of getting bored. He's like, well, what else is there to do in this industry? I've kind of done everything I wanted to do here. That was when it started looking pretty serious between mum and dad. That was when my grandfather, William, offered to teach Dad and to show him the works and start to work.
Humans or animals?
Both.
Okay.
Dad was initially taught both. Then after my grandfather passed away, because I was very young, I didn't actually know him personally. He died when I was about 3. That's when my father took it to the next level.
Right.
And so really focused down on it and just focused specifically on treating. Started with racing greyhounds and race horses, but then eventually progressed into the other domestic dog world and working dogs in other areas.
I must add here that I'm always impressed how the equine arena and the greyhound arena always were very accepting of alternate therapies, like holistic therapies, including supplements, a long way before anybody else was considering them or touching them. I remember early in my career, I've never been involved in racing animals of any type.
Yeah.
However, I used to take my dogs down to a swimming pool, and I used to co-own a swimming pool for a period of time in Melbourne. And people would bring their greyhounds down and do, like water work if they had any light injuries or something like that. And even for that was a fringe of what was acceptable and so forth. But the thing that I got out of it, the interest that I always had, was how approachable and how acceptable they were in doing things like massage and manipulation and supplementation. And that sort of piqued my interest back then, because they used to say to me, oh, you should have your dog on this, you should have your dog on that. And funnily enough, they were very anti-kibbles way back when it was trendy to be involved in kibbles, where it's taken a bit of a turn on that as well.
Sure.
But even in those early days, they were always the fresh feeders. They were feeding wholesome foods that they made up themselves, and they were supplementing much like a person going to gym would be, like they're eating their proteins and they're very strict around their carbohydrates, and they're using the creatines and proteins and supplementations and so forth. And I found that they were very much like that in their animals as well. And suddenly science has come in and supported it finally.
Yep.
Because we've now got the internet and we're not sort of going through mainstream media, and, we can kick out the pharmaceutical company who stranglehold the information coming out. Now people are actually coming out who are creditable people, and people have gone on to do degrees and doctorates and so forth in it themselves, where they're now saying supplementation isn't the woo that you were told it was. It's not a load of rubbish. And, holistic therapies using manipulation and acupuncture in animals, once again, has very profound impact on recovery in animals.
Absolutely.
So if we're seeing that in ourselves, and the parallels that you drew before, where you could have something like a GP, where a GP says, take this pharmaceutical, or you need surgery, or you need this, that, and the other. Whereas where they see that it could be something that needs a physiotherapist, you need some weeks of rehabilitation, you need to build your muscle back. And my doctor said that to me before. I had a jiu-jitsu injury on my arm. I went to see him. We did an x-ray because we thought, there could be a fracture there.
Yep.
He just said, no fracture. And he said, so that's the end of me. I've got a colleague who's a really good sports physio. Go and see him, which was fantastic. So instead of just putting me on anti-inflammatories and saying just take medication to fix the problem, I was actually pleased that he went and sent me to somebody who took me through a range of motions, and I actually saw incredible benefit.
Yeah, great.
I was really enthusiastic to meet you originally because when this incident happened with Ladybug, and to roll back the curtain a little bit, she didn't actually break her back. She had a spinal hematoma.
Oh, sorry.
Same. She literally paralyzed herself with the incident that went on. But it was the peak of COVID. Everyone's heard the story before. My colleague, Melanie Benware, a lady that's in the United States, she was asking me like 1,000,001 questions. And she said, find someone that does acupuncture, because her friend who's a holistic vet over in Virginia, she said, find someone who does holistic acupuncture, get them as soon as you possibly can. She said, Alison is telling me you need to act on this quickly. I found you through Neville Bennett, through the Rottweiler Club.
Yeah.
So Neville, who's a great friend of both mine and Pat's, I was reaching out to friends of mine. I put it out on social media, and Neville said, mate, Neil Barnsley, he's your man. You've got to go and see him. He's like a witch doctor. He's amazing. and I said, give me the deets, mate. Tell me all about him. And he said, he's treated my dogs before. He does heaps of dogs in the Roddy Club. He's the man. Like if anyone's going to make your dog transform, it's Neil. So I spoke a bit more to Melanie, and she said, what sort of acupuncture does he do? And I said, Narelle's looked into it. We've made the appointment. He does, what do you call it, Neil, where you put the current through? What's it?
Electroacupuncture.
Electroacupuncture. That immediately intrigued me because I've had acupuncture myself. I've had acupuncture for a range of different things. I've never had electroacupuncture. And I was absolutely fascinated to see all about it and to meet you and to see what you're doing. Not only was it a great introduction for you, but it was also an emergence of Narelle's creativity to get involved in that space as well.
Yeah.
So it was kind of like two superpowers coming together at once, and which Since we've been here and having the discussion, Ladybug came running out, and it's coming up to her 5-year anniversary of her original suggested death date. So she's made 5 years past that original surgery where the medical profession was willing to give up on her. And you, my friend, said, no, I can see hope.
Yeah.
I'd been sooking for weeks over it, you know, like I'd been sobbing and couldn't hold myself together because it's my little heart dog. And then you said, yep, I can see benefit here. I think we're going to get a reemergence from her. And we did. We saw, I think within weeks of her coming to see you for a couple of sessions, like once a week or twice a week, was it?
Typically once a week for the first 4 weeks. If they're severe, we typically see them twice a week for the first 2 weeks in the 4-week period.
Yep.
And then once we start seeing some results and seeing some strength coming to that back legs, typically when they can hold their own weight and we're starting to see them take little tiny steps forward, that's when we'll stretch it out to once a fortnight. And then once we can get to the point where they're starting to take some little wobbly steps forward, that's when we transition to maybe every 3 weeks or so.
Even on Narelle's marketing people did a little clip on Ladybug because she's part of the origin story of Canine Surgicals.
Yeah.
And there's video of her in your studio with little probes hooked up onto her and she's sitting there with her shaved back and she's got about 20 little different in all the little vital areas where you've hooked her up and you've got the battery connected up to her.
Yep.
And it was just amazing. It was amazing to watch her. Ladybug can get quite fidgety and anxious about those sort of things, yet she got up on your table and it was the most relaxed I saw her. And,
great.
you know, after all that trauma that she'd been through, I remember having a conversation with you while I was filming the session and she was just sitting up there. She was chilled out and she looked like it was actually giving her physical relief.
Sure.
She even slept well the nights when we brought her home from your place. And it wasn't long after that I said to Narelle, she's moving. Like I can see her moving her back legs.
Yeah, sure.
So she went from complete inability to do it, inability to urinate on her own. We had to express her, which was painful in itself. And then suddenly with the progression of everything, we started to see her going from dragging her legs completely and having to be lifted in and out and having to be expressed into starting to flicker her legs a little bit at the end.
Yeah.
And then when we were doing the suggested work that you were talking about doing at home on the balls and everything like that, I started seeing her bunny kick with the back of her legs. And then it suddenly sprung to life, like her memory of her nervous system started to reboot.
Sure.
And it's something that you said at the time. You said you should see her starting to reboot when she remembers, you know, like when her brain and her spinal column are resynchronizing, you'll see like a rebooting going on. And it happened exactly like you said. Mate, it was a very emotional time for us. We were worried, we were concerned, we were so happy when we could see things starting to transgress. And since that time, people have heard it on the podcast. They've reached out to me and they've said, tell me who this guy is. Friends and colleagues and people that have been involved in the training world and people who listen to us have been there and they've come back and said, mate, you're right. The guy is incredible. He just has this unearthly way of connecting with animals.
Yeah,
and I said,
awesome.
he's a pretty unique individual.
And that's kind of why I love what I do. Like to see those sorts of things happening with the heart dogs for people where they're contemplating having to put this dog down. And so many of them are like 4, maybe sometimes up to 6 years of age, because that's usually when it hits with French Bulldogs and Dachshunds. It's about that 4 to 6 years of age. Yeah, they're devastated. So to be able to give them a way out of that and hope and in most cases get them back to where they were before, that's why I love doing what I do. And if you talk about origin stories, that's kind of how I made the call and the decision to follow my dad. Was that I was probably about 20 years old by this point, and I was faffing around with various other sort of careers and so forth. But this particular day I was down in my father's clinic. One of the clients was coming in with a similar sort of case where the dog was paralyzed. He'd been seeing this particular dog for about 3 or 4 weeks. And this was the day that it had come in and it was walking. The client was just in tears and just so thankful. I was watching this kind of communication between dad and the owner and the dog. And I'm just looking at it going, this is like a superpower. How can I do this? This is amazing. Shout out to dad. Dad, you're still my hero.
Is your dad still around?
Yeah, he's still here. He's retired, moved down the south coast, but yeah, he's still around.
Yeah, nice.
Doesn't work anymore in the field. Does a few things on the side just to keep him busy, but pretty much retired. But it was that moment for me where it was like, that's what I want to do. That was when I started my journey.
There was a guy that I knew in Victoria. I know his last name is Schofield. I just can't remember his. Do you remember?
That'd be Peter Schofield.
Peter Schofield?
No, his father, George Schofield.
Yeah.
The very first introduction I ever had to this type of therapy was with a guy called George Schofield in Victoria.
Yeah.
At the time, vets were very clinical about their approach to everything, and they were very reluctant to give work or recommendations to people in that sort of area because it wasn't really deemed as something that would be beneficial.
Yep.
Yet my vet at the time, lovely guy called Dr. Murray Clark, he was a terrific vet. And I remember my dog, he jumped over some agility equipment. This is my old dog, Harley, jumped over some agility equipment and he hurt his back. I could just see that he was in pain, like he'd twinge, he'd stretch. He was looking at his back and I thought, something's happened. So I took him to see Murray. Murray did an x-ray. He said, look, nothing's broken, nothing's fractured. Go and see George Schofield. He said, the guy has hands of a god. And I said, tell me, what does he do? And he said, well, he's not a vet or anything like that, but he's brilliant at rehabilitation. And I went and saw him and George said to me, walk him up in here. And he was watching me walk the dog up and down the line. And he said, oh, yeah, he's out on the left side. He said, I think he's got like a bit of a rotation on one of his lower vertebrae. Let me just do a bit of massage first and we'll manipulate him. And Harley was a big dog, like he was a big, robust dog. And even though he wasn't an aggressive dog, most people were like, can I put hands on him?
Yeah.
George just walked over to him straight away, loved on him, grabbed his head and just gave him a big cuddle and ran his hands down. And Harley was just like, oh, this is, you could see he was just like, oh, this is heaven. He's just sitting there like making this dopey looking face. Yeah. And he just picked his leg up and he went crack. And it made a very loud, audible crack. Without a word of a lie, it was almost like an instant heal. Yeah. Like you'd seen the relief on his face, which I do when I go to my amazing chiropractor too. Yeah. It was unbelievable. And that for me, that changed my whole landscape on the integration that vets have versus people that do have a connection with this type of rehabilitation with animals. So it's not something that should be mocked or something that should be looked at woo. I mean, there's so much science now to support it. And the world really has come on where, you know, people are educating now in that space. People are doing courses in that space. And there's people like yourself. Do you do any education around it, Neil? Are you educating?
Not currently, but something I might be looking at in the future.
You should. There's a saying that if you hold the knowledge, then you have a responsibility to pass it on.
Yeah.
Bring us back, Neil. You're in your father's clinic. You're 20 years old.
Yep.
You observe this amazing transformation at the hands of your father.
Yep.
You go, oh, I want to be involved in that.
Yep.
What are the steps before you do that yourself?
So from that point, it was, okay, what do I need to do to get to where Dad is now? And the process was very different to what it was when Dad went through it 25 years before. Nowadays, there's specific training. So I decided to go probably the long way around, but I felt it was the best foundation. So I did a 4-year degree in human Chinese medicine involving acupuncture and Chinese herbal medicine.
Where'd you do that?
So that was in University of Western Sydney.
Okay. So that's something they offer here.
They do, yeah. Part of that course, though, is at the end of that 4 years, you then have to do a stint in China. I
was about to say you travelled abroad and did that, didn't you?
Yeah. So that was part of the end of that training. Keeping in mind that part was just for humans. But when I was over there, I was very fortunate enough that I was put in contact with one of the head lecturers of the Veterinary Chinese Medicine University in Nanjing. He had just recently retired from full-time lecturing to spend more time in his clinics. I was very fortunate enough that my lecturer got me in contact with him. He was willing to teach me one-on-one while I was there.
Amazing.
It was pretty full on. I was there 7 days a week. He was very specific that I had to do Tai Chi at night. So I was doing that as well.
Tell me why.
Chinese medicine, particularly with acupuncture, isn't just necessarily putting in specific needles in very specific locations. It's also trying to understand that the body has energy flowing through it. Chi. Nowadays, I guess science would look at it as electromagnetic fields, electromagnetic energy and the resonance in our body. So he was of the belief that when you're doing acupuncture, you're not just putting needles in particular points. You need to be able to manipulate those electromagnetic fields in a particular way. And to do that, you need to have strong electromagnetic fields or chi of your own. And so that's why he was very, very specific that I needed to do Tai Chi while I was doing that, which was pretty tiring, but it was also rewarding as well. So by the end of that time, I was able to come back with almost a double degree. So I had the degree in Chinese medicine for veterinarian as well. Once I come back, I was doing, within that 4-year period, I was kind of doing an apprenticeship with my dad as well. So when I wasn't at university, I was in the clinic. I was in the room with him. I was just learning. It's one of those things where the treatments, they can be taught. The protocols for treating particular issues can be taught. And you can pick that up relatively quickly if you have a pretty good understanding of the subject that you're working with, such as canine anatomy, on top of Chinese medicine, using acupuncture, infrared laser therapy. If you know these techniques, teaching protocols for treatment is relatively easy. What is difficult is trying to find out what the problem is. So having a dog coming in, being able to actually listen to what the client is saying about the dog, why he's limping, where do they see the limp, how long it's been happening for, if they can remember a particular issue that caused it. All these different things, it's kind of like putting a puzzle together, because you can't just ask the dog what's wrong with him. So before I even start examining the dog, I'm always asking questions to try and get a background, a history of what's happened with the dog to get to this point. And then that will give me a much better indication of what I'm dealing with. Then we will tend to do a gait analysis. So I'll watch them walk and gait to see whether there's an actual limp. In a lot of cases, people might think they're limping, say, for instance, on the right leg, and it's actually left. So it's important to be able to see them move so then I can determine exactly which leg it is. Then after that, that's when we go to actual physical examination, to be able to go through and examine the dog to try and find out where the problem is. And a lot of things can be missed without that. You need that physical examination. And unfortunately, it's a skill that's being lost nowadays. Physical examination, to be able to find where the issue is being lost. Diagnostic imaging is becoming the gold standard for trying to determine where the issues are, and it doesn't give you the full picture.
It's funny you
X-rays.
said that. My sister and I were just having a chat. I was over in Ingleside this morning, and on the way back, my sister rang me, and she was talking to me about an issue she had where she was hit in the shin by something.
Yeah.
They x-rayed, and she went back and she said, no, it still saw there's something wrong. I need an MRI or something like that, because they said it's just bruising, it's just swelling. And she said, no, there's something wrong. I can feel it in my body. I'm trusting that there's something going on. My body keeps telling me there's something going on. They chalked it up to her just being a pain in the ass and talking a bit of shit. They finally went into doing an MRI on her shin and found that she had a small fracture in there.
Yeah, there you go.
And it was creating a problem for her, so they had to treat it. So as you said, sometimes it's quickly dismissed, whereas where symptoms keep going and you can feel physical pain. The difficulty for you is you've got animals that can't communicate back to you. They can only show it when you press on those points or when you actually physically see it.
Yeah, I mean, they do communicate in different ways. So we physically can't ask them what's wrong with them, but we can ask them in different ways.
Yes.
So if I press on this area, does that hurt? We're not looking for yelping. We're not looking for anything that severe in a reaction, because they rarely will yelp. It's more about how does their body react when I do this? If they're panting, do they stop panting? Do they lift their lips? Do they turn around and give me the look? All these sorts of subtle signs that we're looking for to indicate that was uncomfortable for them, particularly when dealing with soft tissue injuries, which is a lot of what I deal with. That's not going to show up on an x-ray. If you've got a ligament injury or a tendon injury or a muscle tear, that's not showing up on an x-ray. So unless you're very specific on where you know where the injury is, and then you're going to invest $5,500 in an MRI scan, a lot of things are missed. And so the art of having skills to be able to physically examine the dog and find where the issues are by doing very predictable tests that are repeatable by flexing and moving the legs and joints in particular ways, being able to palpate and test particular parts of the spine to know where the issue can be, is vital to be able to know what to treat.
I know what
start
palpate
treating.
means, but explain it to the public
listeners.
what palpate means.
Palpation means applying pressure, pressing or manipulating an area of the body to see how it feels, but also how they react.
Yep.
So muscle tissue, for instance, in a working shepherd or Malinois, they're very strong and their muscles are usually pretty taut. So if there's any signs of softness or squishiness in the muscle or soft tissue, that's unusual. And so that would be an indicator that there could be a problem there. Testing, say, for instance, a little Shih Tzu, they may not necessarily have the same muscle structure, but they will react in similar ways. Their body may be soft and squishy because they spend their life on a couch, but the way that they react to that palpation will be the same. Yeah.
And when you talk about like that manual therapy, you're feeling the alignments a lot, like with your hands, right? Like there's a lot of just experience of someone has come in with a known injury. To get good at that, what you're like, oh, okay, well, I know you have this injury. Let me have a feel of this because we have the scan. I can confirm the feel by hand. Or Was this happening prior with you where your father would be like, no, feel this is what this is?
Yeah, it's a combination of those two things, repetition. Say, for instance, testing the wrist joint of their front legs. There's a certain amount of flexibility that a wrist joint should have, and that varies from breed to breed, but each front leg should have the same flexibility. If one doesn't flex as far as the other one, then that joint has a problem.
Mm-hmm.
Whether it's a current injury or an old injury, there's an issue there. I wouldn't necessarily say it's feel per se. I genuinely believe this is a teachable skill. It just takes specific learning and repetition.
Mm-hmm.
And if you can put the time into it, I genuinely believe you can teach anyone, even people at home, particularly with dogs which can be reactive or nervous when they go to the vet. To be able to have that skill, to be able to examine and check your own dog in a relaxed environment at home, you'll get a much better idea of what's really going on. Because when they go to the vet, they can be really rigid and really uncomfortable.
So you're back from China. You're working with your father.
Yep.
Keep us going with the story.
So working with Dad. So after I finished and graduated, then I was working with Dad for a time, probably about 6 months or so. And then I went over to America to do another stint in some training, furthering my education in chiropractic. So I did a course over there in veterinary chiropractic work, which was really great.
Whereabouts in America?
This was in Irvine, over in LA.
Mm-hmm.
So I was there for a time. The fellow that was teaching us all there, sadly, he passed away last year. But it was a wonderful training. So I've used that quite a lot in conjunction with the stuff I've learned from my father, Gary, as well as obviously the training I learned from the 4 years in the degree and the time in China. So combining them all, I kind of have a pretty unique set of tools that I'm able to utilize in various different ways. So Glenn, you mentioned earlier that we did electroacupuncture on ladybug. So I won't use electrical acupuncture on every case of paralysis I see. There's different needs for different issues. If I had someone that's come in with paralysis but it only occurred a week ago or 2 weeks ago and they haven't had surgery and they're just kind of resting, we wouldn't use electroacupuncture.
Why is that?
It'd be too stimulating.
Okay.
So it would actually cause potentially more inflammation to occur in the injury site.
Yep.
We would use a different type of acupuncture, which is still stimulating the nerves, but not severe enough or intensive enough where it may cause a bit of irritation.
Mm-hmm.
And having the experience to know which type to use just comes with time.
Is there a perfect window for that type of therapy?
It's very much the sooner you get into it, the better, within reason.
Right.
So say, for instance, if someone rang me today and said, my dog's just gone down, he's no longer walking, it happened yesterday, I woke up this morning and he can't move, what do I do? In that particular case, then we wouldn't typically jump straight into treatment. We'd probably say, look, probably best to go to your vet, get him on some anti-inflammatories, keep him rested for about 5 to 7 days, then we'll see him. The reason I say that is because inflammation can take anywhere up to 72 hours to fully reach its peak. And so when they're in that period of time, it's very important to keep them as still as possible because that swelling can very easily start to compress the nerves more and more. And if the more they move, then the more it can compress those nerves. So if they're, say, for instance, an anxious traveler and they've got to travel an hour, hour and a half to see me, there's a lot of time there where they could be shifting and shuffling around in the car that I have no control of. And that can actually cause more issues. So in those first 5 to 7 days, I find it's much more important to just try and keep them as quiet as possible, get them onto an anti-inflammatory immediately to try and get the swelling down and just keep them rested. Then after that, that's when we'd probably start treating. So usually within 7 to 14 days of the injury, that's when I like to start to treat.
What's the most common injury that you see?
Now, I would say that spinal paralysis would be one of the most common things I see now.
Wow, okay.
Particularly with sausage dogs or dachshunds and French bulldogs. They're the two main breeds that I see now. It's a combination of two things. One, the genetic weaknesses that they both have. Dachshunds can get a condition called IVDD or intravertebral disc disease. And this is a condition where the discs themselves are the soft tissue that's holding the bony vertebrae together in the spine. There's a change in the actual makeup of those discs. So an intravertebral disc is made up of two main things. There's rings of ligament around the outside of the disc, and that's the tough stuff that's able to hold the disc together and combine all those vertebral pieces together, but also allow flexibility. In the center of these rings is like this jelly-like material, almost like the inside of a jam donut. So it's quite soft, it's jelly-like, It should be able to absorb shock and vibration. So when we shift and move and jump and twist, as a dog does as well, there's constant vibration going through the spine, constant irritation. And these discs are designed to absorb that shock, to absorb that vibration that can, other way, cause inflammation or irritation if they land in the wrong way. So with intervertebral disc disease, that stuff hardens, it calcifies. And so then it's not able to absorb the shock. It's not able to be as flexible as it should. And so then that puts a lot more pressure on the ligaments around that section. And that's when we start to get tearing of those ligament rings that are around the outside of that disc. And that's when we get inflammation that builds up. That inflammation is then what puts pressure on the spinal cord and the nerves around it. And that's when we start to see paralysis start to occur.
And you think that's like just a genetic thing that's kind of creeping in those breeds?
Unfortunately, yes. It's a genetic condition that affects 1 in 4 Dachshunds at the moment.
Wow.
It's becoming more and more common in French Bulldogs. Frenchies unfortunately have a second issue called hemivertebra. And this is when the vertebrae themselves are deformed. So
yeah,
where
it's
they
like a
should
butterfly.
That's right. They should be like square or rectangular in shape.
Yep.
But when you do an X-ray or an MRI scan of a French Bulldog's spine, you'll see that the vertebrae, so the bony bits where they should be nice and square and uniform, they're all odd shapes. Anything from rectangular, oblongs, some of them just like a little tiny wedge. And so what this is doing is putting really excessive pressure, not only on the discs that are holding each together, but if they're not perfectly aligned, which a lot of them are not, that'll put extra pressure on the spinal cord that's running through the center of the spine. We're seeing this more and more. Unfortunately, the last data was showing that about 93% of French Bulldogs are now affected by this.
Wow.
And it's getting worse and worse.
Yeah, right. That's concerning.
And unfortunately, because it is such a popular breed, it's attracting a lot of, shall we say, breeders that aren't as conscious of these health issues or care, and they're in it for the money. And unfortunately, a lot of people that are purchasing these puppies think, oh, I got this beautiful, quirky French Bulldog, and then in about 3 to 4 years, they've then got a paralysed dog.
It's no secret that Narelle and I love French Bulldogs, but we have concluded that we wouldn't own them again after this, after our little group phase out.
Yeah.
That's it for us with French Bulldogs.
Yeah, it's really disheartening because it's happening more and more. But what's exciting is they've determined the gene that actually causes this. They've been able to track what that gene is, and they've isolated it. And they now know that that's why we've got 93% of the French Bulldogs affected by it. But now that they've isolated it, they actually know now that it's a recessive gene. So what that means is it can actually bred out. It can be bred out if people choose to.
Right.
The problem is that if they do breed out this genetic deformity, it will mean that they'll have to, because of the amount of dogs that are affected by this gene, they'll probably have to outcross to another breed for a short period of time to bring that strength back in. So when we have recessive genes, what that means is that for a dog to be affected and for it to adjust the way that their body is made, there has to be 2 genes coming. So 1 gene from the mum, 1 gene from the dad. So if they both have the same gene and they are both affected, then their offspring are going to be affected.
Yep.
But if they only have 1 representation of that gene and the dad only has 1 representation of that gene, their kids won't be affected. There's a couple that might be, but the majority won't be. They'll be carriers, but they won't be affected.
Mm-hmm.
So it wouldn't take long for this to be bred out if people really wanted to really make an effort. The downside to this, and I mean, some may see it as a downside, I don't really care, is that they would actually have tails instead of this little tiny nub screw tail. Let me ask you a question, Glenn.
Sure.
If I said to you that you could have another French Bulldog and you wouldn't have spinal issues, you wouldn't have breathing issues, you probably wouldn't have skin issues or digestive problems either, because there's a lot of those that have been confirmed to be attached to this gene. Would that be an acceptable trade-off if she had a little tail?
It wouldn't bother me. And the reason that I say that is because I already went through that dilemma with Rottweilers when we were going through the docking. I was the opposed group to allowing tails back in the day because I'd been brought up with docked tails.
Yeah.
I bred Rottweilers and I didn't dock, the vets docked. But at that stage, I was for docked tails. All my Rottweilers now, because it's illegal anyway, but all my Rottweilers since have had tails. And I love the look of the tail on my current Rottweiler. He has an amazing looking tail, For me, it's not really about the tail anymore. It's more about the ongoing health.
Yeah.
The trade-off is, it wouldn't matter for me if I had a happy, healthy dog with a promising future and longevity. That was the main thing for me.
Yeah.
And as I've indicated before, because of the issues with heat distress, because of the issues with the likelihood of spinal damage and so forth, Opie, he's our old man now that we've got. His spine is a disaster.
Yeah.
He's still running around. He's still getting around. He's okay, but he's been backwards and forwards. He's been on pain meds and CBD and he's on PEA and all those sort of things ongoing all the time. He's happy. He's drifting about. He's doing his thing. He's a little potato head.
Yeah.
But once we're done with them, we're done with them. That's the conclusion. That's heartbreaking because I love French Bulldogs.
Yeah.
I love their quirky nature. I love how they're a little pocket dynamo in a little body, but the problem is their body just fucking explodes.
Yeah.
It's so goddamn heartbreaking because they're like, and for me and Narelle, we never had children. They're like children. They're like little babies, you know, like they're part of your little family. And when you see them in that level of distress, it kills you inside.
Yeah, it's heartbreaking.
Mate, there's not much that really gets to me in life. There's not many people or things that really bother me. But when I see the dogs going through that suffer, like the distress and anxiety and everything that it creates. Like even the other night, Ladybug got a really, really bad form of gastro and she was really distressed. She was throwing up. She wouldn't eat and she could eat concrete and ground up broken glass. She wouldn't care. She's got a stomach like cast iron. She'll just go through anything. And, she was really, really sick. It lasted about 3 days, but the whole time she was like that, I was in complete distress.
Yeah.
I can't think properly. I'm agitated. People are trying to talk to me and I can feel my temper flaring because all I can think about is my dog and I'm worried about her all the time. It just drives you mad.
Yeah.
Even the whole spinal thing that we had to go through, that was some of the worst torture I've had to go through.
Yeah. And that's probably the one thing I would say is these genetic changes that I'm referring to, that's going to take decades.
Absolutely.
But what
did with entropia and all those sort of things that they were trying to phase out. And that probably took about 15 years of solid work.
Yeah.
Star cataracts was the other one that they were trying to eliminate in Rottweilers.
Yeah. And that's with breeders on board, right?
That's with breeders on board.
So
now
in
it's
this
JLPP and all those sort of things. They're really trying to have a conscious screening against breeding with those type of dogs. Sometimes people get upset about the militant operation that dog clubs have with that, but it's absolutely necessary.
Yeah.
Just because you have a love or a desire with your dog, you've got to understand, as you put out before, that recessive gene, once that starts traveling around and you've got, like a mating partner picked out who's got it in the line and your dog's got it in the line, the likelihood of that springing back again and, it's kind of viral. It takes off and then again, you've got more dogs with more problems and more disastrous futures for these dogs.
Well, I think 5 to 10 years ago is when Frenchies really came in vogue, right?
Big time.
And I remember hearing about people spending like 30 grand on Frenchie puppies.
On those unusual colours, the blues and the merles.
And the majority of Frenchie breeders, they were just jonos who had an expensive Frenchie themselves and were looking to recover a lot of the money. So they weren't dog world people. Their dogs weren't being issued pedigrees. Not that I'm a pedigree guy, but you got to know what you're breeding to what and why. And I think there was not much of that. But I think Frenchies have gone out of vogue. I think largely because that fad is over, but also there's a lot of people with a lot of very expensive injured Frenchies. Yeah. And so it'd be interesting to see what happens in that space now, I think, like whether that breed can be recovered by the purists of the breed that really love it, now that the public probably aren't as keen on Frenchies as they were. Yeah. It'd be remiss of me not to give a shout out. We have had Katrina on the show.
I was going to mention Katrina.
So we have a friend, Katrina, who's been on the show. She's a bit of a genetics expert, right? Like she's been breeding things, cattle and dogs and all kinds of stuff her whole life. And her and some friends of hers have what they call this mini bull project. It's essentially a fake Frenchie.
Yeah, right.
They call it a mini bull. They're wonderful little dogs. They look a bit like a Frenchie, but they're a very well put together little dog.
Run all day, robust, no breathing issues. Yeah. It's the dog that you indicated before.
Yeah, sure.
When you said they're going to have to outcross, I was like, that's what they need to outcross to.
Might be a good one to go with.
Yeah, and so I'm not sure how long the mini bull project guys have been at it, but to my knowledge, there's 3 or 4 of them or something like that have been at it for maybe 15, 20 years to put together this little breed. I'm very aware of it because some friends of mine have them. They're fun little dogs, but they used to home all the dogs with like my puppy course. And so I was in their Facebook group and because they're geneticists of a type, they keep very close tabs on their dogs, right?
That's awesome.
it drew a bit of heat when Katrina mentioned it on the show, but they de-sex very early before the dogs are homed because they don't want anyone fucking up their breed, right? Mm-hmm. It's not that they're like, we don't want people making money off of this. Yeah. It's that we have put a lot of work into making a very healthy, fantastic little bulldog.
Yeah.
Don't fuck it up on us.
Yeah.
Right?
Yeah.
That'll be interesting to see what happens with the Frenchies.
In between that time, though, I guess if there was anyone out there that was thinking of getting a French bulldog, one thing I would suggest is when you're selecting a breeder, choose a breeder that's willing to show you either the X-rays or the MRI scans of the parents. Because if they're breeding properly and they're breeding ethically, then they're doing these tests. And this is essentially why French bulldogs were so expensive in the beginning. It wasn't because they're popular or were popular. It was more so because if you're doing the breeding properly, you've got to be doing the DNA tests, you've got to be doing the X-rays, you've got to be doing MRI scans to make sure the spinal cord is clear. You've got to be doing
C-section birth as well.
You got the C-section birth, that's right. So all these different costs, I mean, they could be 30 grand in the hole before they even start.
Yeah.
So that's kind of why they were as expensive as they were originally. And I think that's why it attracted other people to breed because they see the price tag and they think, oh, this is just a quick way to make money.
That sort of database has been around for a while, like the Rottweiler Club, the German Shepherd Club, and a lot of the, Golden Retriever groups and so forth had effectively eliminated a lot of the genetic issues related to hip dysplasia and OCD and so forth because they were so stringent on X-rays.
Yeah.
All of my dogs have been X-rayed. They've all been up to the vet. They've all gone through the scheme. They're all part of the national database, which I totally agree with and support. And I encourage people to do the same as well. Like people then getting into sports and they were saying, oh, the dog doesn't need a pedigree and blah, blah, blah. I don't care about this and that. And I said, but if you go off and breed that dog, you don't know if you're going to be part of that problem again. And they say, oh, yeah, but these people, they do this, that, and the other. And I said, but there's a reason for it because you weren't round in the osteochondritis days when dogs couldn't walk on their front legs anymore or their back legs sounded like gears in a car grinding because they've got no rotators to walk on anymore. It's a horrible thing to see some of the junky old stuff that people had to drive out of town. They had to work hard on a world scale to remove all that sort of stuff, and I get it. Neil, there's a question I did want to ask from earlier on. I know we're sort of still teasing at your origin story.
Sure.
When people present to you, ahead of that time, what would you like them to prepare for you as far as information that they could get to you? So let's say, for example, like I found that my dog is limping and I'm going to make an appointment to bring the dog to you.
Sure.
Or presented with something like a problem with the spine, problem with the leg.
Yep.
What questions would you want the general public to prepare ahead of time so they can do a little bit of R&D before they get in there and just say, I don't know what's going on?
Yeah. It's always good to know how long the limp has been there for. And if there was an incident they can recall that may have triggered that limp to occur. Not only that, but also what have they tried between the time that they saw that limp to now? How long has that been? And then going into, has it changed? Has it improved since it happened? Has it actually gotten worse? Is it intermittent? So when he gets up from lying down, is it there and then it kind of goes away, or is it just there all the time? And also a video can be really helpful too, because sometimes I can't get them in for 2 or 3 weeks. So it's nice to be able to see a video of what it was like to begin with. So then that gives me a much better idea of what we're working with when we see them. Because in that 2 to 3 weeks time, they can actually start to get better. So when we see them, when we're doing the gait analysis, when we're watching them walk, sometimes the limp isn't as obvious. And so when we see it the way it was when it originally happened, we get a much better idea of what we're dealing with. So a video of how they're moving when they can see the limp can also be really helpful.
Let's just talk about the quality and the standard of the video, because that's a bone of contention myself. Like I've asked people just on dog training to show me things before, and people literally, it's like they've got the camera glued to the dog's ass when they send the video to me. And I said, no, that's not the video. I need somebody, a third party filming the dog or from certain angles. So what would you suggest there? Because I think that's really important when you're talking about gait and movement.
Yeah, absolutely. Preferably more of a side-on view. So instead of being from the front or the back, kind of a side-on view, and a good 5 to 10 meters away, so you can actually see the way he's moving or she is moving in like a rhythm. So sometimes the limp isn't super obvious. Rarely will they be sitting there with their leg off the ground. So usually it's kind of watching them walk for a period of a good 20, 25 meters before you can actually see the pattern of where that limp is. If it's only a subtle limp, you need to watch them for that period of time. If it's severe, it's easy as pie. You can see that when they're walking in the door. But sometimes it's subtle, and sometimes we need to see them walk over a longer period. So if we can have a step back, maybe 10 meters on the side, that gives us a much better indicator of what's happening. So whether it's with me or with whatever practitioner they're seeing, especially the people around the world, going into seeing that practitioner with a video of that nature makes it so much easier and makes it much easier for them to find where the issue is.
That's good to know. Mate, I reckon, as a trainer, when people say, oh, you deal in behavior cases, tell us about the biggest success. There's 2 or 3 in my mind, right?
Yeah.
Where I've really turned a dog around. And on the days where I think, fuck all this, I'm quitting, they're the ones that I think about.
We have those days, don't we?
You've got to have a few of those. Tell us a story about a big turnaround that you've seen.
So there's probably one of the ones that comes to mind, probably one that's more recent at the moment, I guess, because again, I'm seeing a lot of these spinal issues where they're on death's door. But there was one that was more recent. She'd gone through surgery, and she'd had the surgery September last year.
What breed?
Dachshunds. Since then, there's been no improvement. She's been completely paralyzed. There's been barely any sort of activity on the back legs, no signs of feeling any sensation in the back feet when pinching them. Yeah, they were really despondent because they were just like, we've got nothing left. We spent all our money on the surgery, and this is where we're ready to pull the plug. We can't do this anymore. So we started seeing them about 4 weeks ago, and we're going through that protocol of seeing them once a week for 4 weeks. First 2 weeks, normally we'd do 2 a week, but this one we just did 1 a week. She came in yesterday. Yeah, she was walking.
Oh, wow.
Yeah. She brought her in, she cradled her in, but then she very proudly put her on the floor and then started walking into the room. Sorry, I'm getting a bit emotional.
No, that's amazing. That's great.
Yeah, it's those sorts of things that, it's those sorts of cases which I know it sounds silly, but even though I see these sort of things every week or every couple of weeks.
Yeah.
They still get to you.
They still get you. But you can see the results. You can see what it means to the people too.
Mate, I get them when I see people with dogs that have been declared like dangerous dogs.
Yeah.
And there are times when we're out in the shed, and it's not often, I'm not saying it happens every time, but there are times when we're out in the shed and, some tears are shed.
Yeah.
Because their whole life is rocked. The invasiveness that's gone on, the probing, like you've got government stepping in, and some of these people are very nice. Some of the animal management people are very nice. They're very patient. But some of them can be narcissistic bullies too.
Yeah.
And they step in and they really fuck their world up. And these people are really distressed about what's actually going on. And seeing their dog make a turnaround, seeing the declaration being taken off and the overwhelm and the joy, and the people are just saying, if it wasn't for you, you're the only one who believed in us. And that is overwhelming. Like you can feel that. Pat and I often talk about spiritual energies, and you're very much like that as well. Like you can feel that sort of energy when you're in a very powerful situation like that.
Yep.
So I get the emotion that you're actually feeling. And Narelle and I remember the journeys into you in the early days, the heavy load and the distress we were feeling about this could be it. We might get a bad diagnosis from you. You might turn around and say, look, it's not going to go anywhere, or it's not going to be improving from this. And that was sort of putting us on a precipice of preparing us for the worst possible outcome. Like this could be the end of the road for Ladybug or anybody else's dog who has come down to you before. And I know you can't, like all other practitioners and people doing rehabilitation or therapies or any holistic treatments, you can't promise that it's all going to go well.
Yeah.
Sometimes it just doesn't.
Yeah.
But the mere fact that you gave us hope that nobody else was willing to share with us. Like with everybody else, it was just like a sad face and like, oh, well, these things happen and it's very sad and blah, blah, blah. And you were very upbeat about it. You said, no, this is going to be good. Mate, I totally get it. I understand why you're feeling emotional about it. Like I've seen Pat very emotional with treatments. He's shared emotions on this podcast when he's dealt with some of the people, that you're dealing with along the way. If you don't feel any connection to your customer and the dogs, I don't think you should be in it. I really think that you really have to question your priorities. It's not to say that everybody has to shed a tear or get emotional about these sort of things, but if you don't feel anything within your soul, if this job doesn't move you, if working with animals and the people that feel the affection or the affliction of what's happening, question it. Ask yourself that very important question, because it might be a little polarizing, what you come up with. But for me, I feel it. I feel that there is a need for it. There's a benefit, and the outcry of affection and appreciation and the thanks that people give you.
Yeah.
Sometimes that's the highest form of reward.
Absolutely. Particularly in this industry where it's not always easy. It's a tough gig. Like I have the highest respect for veterinarians. For what they do,
that's
it's
tough.
a tough gig.
That's a tough gig.
It's really no wonder that it's one of the highest rates of suicide in any industry.
Yep.
Because, I mean, most of them, I would imagine, are going into it because they genuinely believe they're going to make a difference to these dogs' lives. And then
they need to be better protected. The vets,
I really think so too.
They really do. There's always unscrupulous people in any field, but the vast majority, and some of them, especially these days, a lot of them are young women, and the abusive chat that they get or the abusive dialogue that goes backwards and forwards between them is outrageous.
Yeah.
It's a form of assault. They're actually being assaulted by people. And even though people are grieving and they're sad and like their world's been rocked, these vets, some of them are working ungodly hours.
Yeah.
They're up at the crack of dawn. They're monitoring dogs. They've got vet nurses who are taking dogs and cats home on their own ability to care for them, to sit up all night with them. And I know these people, like I share stories with these people, and the violation that they get, I know it's upsetting for people and anybody who's listening to this. It is very, very upsetting when you rock with emotion, but you got to understand, like, these people have generally tried everything.
Yeah.
They pulled every rabbit out of their hat that they possibly could. So that's why I'm saying they need to be better protected. They need to be more respected and taken care of.
Yep.
I've run into vets that I found like they could have a much better bedside manner. You know, they can be rude and they can be past the job. And, you know, they're the sort of people who create like a bit of a lasting image for people who are overwhelmed with all of those flooding emotions. But the vast majority of them are really good people, and they try everything.
Yeah. That's one of the reasons why I didn't want to become a standard sort of veterinarian practice was I didn't want to have to deal with that. And I'm very fortunate with my line of work where there's only a very certain type of person that's going to spend half a day of their life to bring their dog to come and see someone like myself. The people that I see day to day they're just lovely. They're such lovely people.
Yeah, so that's what I wanted to talk to you about. There's one thing I do want to touch on before we move to there. We mentioned it just briefly before we started. So my dog's a bit of a lunatic, like most working dogs. And the first time I brought him to see you, I don't know if you remember, but I had his harness, I had the ball, I had the food, I had the muzzle, I had all the tools because I was like, how the fuck's this going to go, right?
Yeah.
Like this dog has a lot going on and he doesn't like being touched. He's not aggressive, but he doesn't like it and he usually tries to avoid people. And like you've got a waiting room and there's other dogs that he's like, my dog is a real dickhead, right? So like he loves intimidating. He's not aggressive, but he's like, hey, I'm a lot. You have to be aware of how much I am, right? And other dogs are like, oh my God, you're too much. So like that's the nature of that style of dog.
Yeah.
But immediately you had him like, he was like, oh, this is good for me, and really consented to the whole treatment and was cooperative and stood there and was not a pain in the ass, to the point where I was like, what the fuck's going on?
Yeah.
Now, that I get a sense is very much like your nature. Like that's a lot of how you interact with the dog.
He's a wizard. He's a real life wizard.
Yeah. But I'm curious, how much do you think is that's just internal to you? How much of that can be learned, and how much, like, knowing now that you've done so much in Chinese medicine and had to do the Tai Chi every night, like how much of that is learned versus how much of it is you?
It's probably a bit of both. I'm a pretty chilled out guy in general. That's kind of my nature. I'm not the type that when I come into a room, it's just like, hey, look at me. I'm usually the wallflower in the corner that's a bit shy to talk to anybody. So my relationship with dogs and animals is usually more of a, I don't try and go up to them and get my hands all over them. It's kind of a mutual respect of just body language. Body language says a lot. I've always had that affinity with animals, even from when I was younger. But a lot of it is also learnt behavior too. So through bitter experience for sure, but also just being me, like not trying to be someone that I'm not. And dogs are usually pretty good with that. And if you try and walk into a room with a dog and be someone that you're not, they know pretty quick. They know pretty quick. Yeah, just trying to be myself and taking time. That's the big thing I would say for anyone that's thinking about getting into this industry is when you are examining a dog, just take your time. The more you rush, the more you try and push it, the more they're not going to work with you. And then it's just going to take longer.
I think an observation I had with you, Neil, watching you first connect with Ladybug when we went to see you, is how curious you are about each case that's presented to you.
Yeah.
You were there as her healer, not her buddy. And I think sometimes people feel like, oh, I have to make a big impression to make this person think I care about their dog. But you gave me the same impression in a different way. Caring about a dog isn't so much about wanting to be friends with it and wanting to be patted, because take Remy, for example. That's not caring about the dog. That's misreading him. Running over to him and putting hands on him and trying to kiss him all over the place and stuff like that.
Yeah.
Some people think that's really important and that the owner will appreciate that. Pat probably wouldn't appreciate that.
Yeah.
You know, like he probably would have looked at it and said, what's this idiot doing? He didn't even ask me about the dog, or he's not showing me any layers of respect to the presence of my animal.
Sure.
And you did the same thing when Ladybug came there. You came over, you put hands on her, you felt her. You were very calm. You gave a calm presence. I was just sitting there grieving in the corner, and Narelle was talking about what was going on. Narelle's very clinical under fire.
Yeah.
So, you know,
Sure.
when those sort of things happen, she can be very diagnostic about what's actually going on. So
Yeah.
you and Narelle were mainly having a conversation. I was just observing and taking it all in my stride and watching what was going on. But that's what I noticed, is that you have this amazing connection to come over and just put your hands on the dog, start feeling, start talking through with the owner. And it was a nice calming presence. And as I said, once you got Ladybug up on the table and you started to do the acupuncture session with her, it was like days, weeks of stress just like left her body. She just flopped down on the table. She was just sitting there. She stopped panting. And I thought, she's just not going to sit still for this. She's not going to tolerate it. I was really worried about it. But everything that I was thinking, I was wrong. And I just thought, I'm the dumb person in the room here. I need to just sit there and watch and take in what's actually going on in this session.
Sure.
So I think those things, they're vastly important as well, is when you've got somebody who has mastery in their field, don't talk too much. Just watch what's going on. Share a little bit of the presence of what's actually happening.
Sure.
I'm not trying to sound ethereal in it, but I just think sometimes people are so busy talking that they actually miss the importance of the lesson or the therapy that's actually taking place.
Going back to the disarming and just quietening the dog, a lot of that comes from the dog's looking at you guys, the owners. They're looking to you for cues. So if the owner's sitting in the room and they're really anxious about why they're here, about possibly what we're going to talk about, what the diagnosis might be, or just worried about their dog not sitting still, if the owner's anxious, then the dog's going to be anxious.
Yeah.
The dog's not looking at me. It's looking at their owner, looking for cues. So if I've tried just focus on the dog to try and keep it calm, I'm wasting my time. You've got to talk to the owner first, calm them down first, get to the bottom of what's happening. And while we're doing that, while we're having that conversation and we're all disarming, we're all just kind of letting the barriers down and actually talking about what's really going on, that's when the dog starts to look around and go, oh, we're in an okay space here. I can relax a little bit. My dad's got this, or my mum's got this. We're fine. That's when I would say that then that would start to relax. So some practitioners tend to make the mistake of focusing primarily on the dog, but you really got to get everyone in the room relaxed.
Tell us a bit more about the typical owner. Like I imagine, like I said, almost my whole club, I'd say close to every dog in the club has been to see you at some point. Because, you know, we put them through the ringer. We do high drive stuff with high drive dogs. And, you know, if a dog limps, it's hey, you got to go see Neil, right? Like that's a thing we say.
It should be a standard.
Yeah, exactly. And like,
I'm serious. It should be a standard. Like, because we were talking earlier on about the equine and the greyhound, those people, it doesn't take much for them to go and see somebody like you. And I think the working dog fraternity, they need to embrace that sort of holistic sort of therapies with their dogs. Like I've been a stickler on it. I've completely changed my whole tune about diet and nutrition on dogs since listening to Narelle and everybody else that she's been interviewing and so forth. I've transformed incredibly. Like my ascension in that has escalated beyond belief. Not because we have skin in the game, but because like you and like Pat and like everybody else who's embraced it, we're seeing the net benefit of it. Like we're absolutely seeing transformation in the lives and the longevity of our dogs or our animals in general. But like I said, the equine people and the greyhound people knew this a long time ago. And just everybody sort of went, that's just what you do with horses and greyhounds.
Yeah. To that end, Gavin, who was on the podcast just last week, his dog came into club one day limping. It's a no-brainer. Like, oh, you got to go get that checked out by Neil. And we don't do shit until then. Like everything's take it easy. And then he comes back and says, oh yeah, we've got to have another 2 weeks off and then we're good to go. Right. So my imagination when I come out to you is like, oh, this is all sport dog people or like people in the field, because as you point out, Glenn, what gets measured gets managed. And that's why horse people and greyhound people have been doing this forever, because they need their fucking animals in good condition, because that's the difference between winning and losing.
Absolutely.
Right? That's why. And for us, like I love my dog deeply, and he's retired, but when he's injured, he gets the medical treatment. Like it's not because I want to win something. There ain't no money in what I do in dogs, right? It's just costs. There's nothing comes back.
Yeah.
But it's because, I'm relying on this dog to be fit. I want that. In my imagination, that's all your clients. But every time I've been to your practice, it ain't
little
that.
pet dogs.
Yeah, it ain't that. Yeah. And I'm like, oh, well, I'm the exception, right? Like I'm the weirdo here.
Yeah.
So what is the average client to you?
Well, that's what I love about my job is it varies so much. I could be seeing working dogs such as yourself in the afternoon, earlier that day, a dog that's paralyzed. The next one, it's a show dog that's gait isn't perfect. The next one is Fifi the poodle that's got a dislocating kneecap, so we're trying to get that to settle down. Another one is a spinal issue, but they're rehabilitating, so we're trying to give it techniques to strengthen as they're going. That's kind of what I love about my job. It's so varied. It's not really the same thing all day, so it's always something different, which keeps your mind active. You always got to be on ball.
Yeah.
I certainly don't see as many racing clients as I used to.
Okay.
So previously, before COVID, I had a very large rural facility where I had space for race horses, lots of racing greyhounds with the trailers and everything like that. But when COVID hit and everything changed, we kind of relocated the clinic to working from home, which then meant I can no longer see race horses and not as much room for racing greyhounds. I definitely do miss parts of it. I miss the trainers. The trainers were great fun.
Yep.
A lot of them are, well, again, the ones that are taking the time to come and see me, they're lovely people, really down to earth and really look after their animals.
I'm glad you said that, because even though there has been a lot of stigma about the racing sports and people's emergence of dislike for it, what they haven't taken into account is the love and the dedication that these people put into their animals.
Yeah.
From what I saw in the early days there was an old guy that lived around the corner from me, and every single morning at 5 o'clock, he had 2 greyhounds.
Yeah.
He had little jackets on them, and he'd be walking up and down the street with them. And he was an old guy, he'd had to be in his late 60s, early 70s or something like that. Like I'd say hello to him because he was just a neighborhood guy. But then one day I chatted to him. I said, do you race these guys? And he goes, no, not anymore. They're retired now. This was the mum and this was the daughter, and she's a triple champion and she's a regional champion and blah, blah, blah. And he was so proud of them.
Yeah,
and
they're proud as punch.
Proud as punch. And I said, and you do this every day? And he goes, yeah, well, this, this is how I raise them.
Yeah.
And it's part of their routine. And he said, keeps me fit. Keeps the dogs fit.
Yep.
And he goes, you can't be a bludger when you got dogs. You have to get out there. And I said, mate, good on you. That's amazing. He goes, yeah, but I love it, mate. He goes, it keeps me young, keeps me fit, gets the lead in my pencil going. He goes, it's all good.
It's definitely something that I would see as well. Like with a lot of the trainers, which only had like small teams, a lot of them are older gentlemen. It keeps them going. It gives them a reason to live. A lot of these blokes, they don't have family. They may have lost their wife, and it's just them. It just gives them a reason to get up in the morning, keeps them going. So,
long story short, when the live baiting issue happened and everyone was up in arms about it, and government was stepping in and vets were stepping in and the public were outraged and wanted the monster slain, so to speak. I was invited in to go and speak to regional parties about not using baits and skins and so forth. And I was showing them images of working dogs. And I said, I know this is difficult and I know it's different. And I know a dead pelt is a dead pelt. I get that. But the general public aren't accepting of it now. You have to find ways around this. And so many of these people were good people. They were so outraged by the fact that they got called in with the people who are doing unscrupulous behaviour.
Yeah.
And they said, we don't do this. We do use pelts, but they're
long dead.
Yeah, they're long dead. They're vermin that have been shot by hunters and they get the pelts off them and use them in training. We don't use live animals.
Yeah.
And I said, mate, I get that. But I get dragged into the unscrupulous world of these 1%ers who cause problems for us in the industry. And I know people like you. I know, I've got family who are involved in this sort of thing as well. I know that you don't do these sort of things.
Yeah.
But you sort of got to work with the public on this. Otherwise, they'll take active steps to completely getting rid of it because they don't understand it. And to them, they don't like it. And the animal rights groups that are behind this driving it are pushing hard for it to stop anyway. It's just one of the things that they're trying to get rid of on their program to get rid of animals altogether.
Yeah.
But that's the unfortunate side of it, is that they don't see the people like you just described, Neil, the people that do have a genuine love, that it is a person that this has given them a reason to get up in the morning, and it's given them something to do, like we do with our sporting dogs. Pat's often had quite an emotional plea on, this is something that my dog is biologically programmed for. We're all doing the right thing by our dogs, and our dogs are an active part of our family. What's the harm?
Yeah.
And there is no harm in it. The only thing that became harm was people started putting it on the internet now that social media came active.
Yeah.
Other people looked at it and said, well, I don't like this. This is not something that I subscribe to, so I want to put a stop to it. And that's the difficulty that we're up to, because they're overwhelmingly larger than what we are in the public. Like, there's a lot of misinformed public out there, and there's a lot of people who prey on them as well and say, great, now that you feel this way, we don't like this, and we have an organised party that want to stop that sort of stuff.
Yeah.
It's madness. It makes me insanely crazy, the fact that unscrupulous people like this on both ends are allowed to get away with it, where common sense sits somewhere in the middle but never gets brought into scrutiny.
Yeah. Because they're not the loud ones, are they? It's the ones on the extreme that are making all the noise.
Always.
The ones in the middle, they're just trying to do their thing.
Just before we started, you mentioned about dogs with a fighting spirit.
Yeah.
Tell us a bit about the difference that you see in dogs that come in like, fuck this, I want to get better, versus the dogs are like, hey, I'm kind of at the end.
I guess a good example is, so I see a lot of older arthritic dogs as well. That can vary from various breeds, but say, for instance, an older Labrador, it's getting a 13, 14, it's had a pretty active life, it's got arthritis in pretty much all its joints, but it's still wanting to be there. It's still happy to be around, but it's just struggling with his mobility. Those sorts of cases, they typically respond quite well because they're still in the game. They still want to be part of the family. They're still interested in what's happening in the household. There are other cases, say, for instance, with an older dog, or as we were just talking about earlier, if they've had a serious spinal injury and they come in, you can kind of tell like whether they've just had enough. They're exhausted and they just don't have any fight left in them. You can tell the difference. They're the ones that don't typically respond terribly well to treatment.
How do you tell the owner that? Because it's not like you deny treatment. You can always help in one way or another.
Yeah, sure.
Right? But surely you have that conversation where you say people like, hey, we're not going to expect much from this. Or...
Typically, the way we go about that is, in a lot of ways, it almost feels like we're doing a bit of counselling for grieving. But essentially it's, okay, we're at this age, we have these issues. Let's see how we go with the treatment for 2 or 3 treatments. Let's see how he responds. If we see improvement and we see some encouragement in the way he's getting around, great. We know we're on the right track and we'll keep going. But if after 3 or 4 weeks we're not seeing any improvement, then we need to start thinking about quality of life of the dog. In that way, I'm kind of setting him up to saying, look, I'm really hopeful for some improvements, and we generally do. But if we don't get to see the right amount of improvement that we're seeing, or we're not seeing their temperament improve to the point where they actually want to be involved in what's happening around them, then I think we owe it to them to give them a dignified end if they're showing signs that they've just had enough.
Yeah, that's just a reality of it, right? And I think that's one of the things that that's always the hardest thing when you get an old dog and you're like, no, there has to be more I can do.
Yeah, absolutely.
Eventually it gets to the point where you're like, hey, yeah, there is more you can do, but it's not ethically correct.
For sure, yeah. And it's probably one of the hardest things in my job because a lot of times I'm seeing these older dogs for like years. Yeah. Like I've seen them since they were 6 or 7, and while they get into their later ends of life, I'm seeing them like every 2 or 3 weeks. By that time, you know these people, you know these dogs. You're seeing them that often. You're sharing your lives together. You're talking about what's happening, and you're seeing these dogs get older. So when it's time, it's hard conversation to have. It does cut you a bit, but that's part of the gig.
There's a little bit of a statement that's been out there in the interwebs world that says better a month early than a day late. And I'm an absolute advocate for that. I left one of my Rottweilers late. I've talked on the show before. It still cuts me up and I think about it readily. I left him like a day late and it was traumatic. And if I had my time again, like if I could rewind the clock, that's one of the things along the stop on the way, I would have taken him in earlier and given him a more dignified end to what went on. I recently had Melanie, the lady I was talking about before, who's a great friend of mine in the United States. Her heart dog, Bogart, just recently had to be euthanized. And she planned it out beautifully. She did everything so well. Like she could see that he was starting to decline. It looked possibly like he had some form of cancer or something like that. I'm not absolutely sure what went on. But she was talking to me up in the time. Also, one of her other colleagues, Jamie, reached out to me and said, hey, Melanie's that stage with Bogart that she's going to put him down. I said, yep, I know. I'm talking to her about it. She did it in a remarkable way. And I knew she was hurting. I knew she was in pain. And the worst side of this for everybody, including my mate Panos, who just lost his dog as well, the worst side of all of it for him is the time leading up to it.
Yeah.
It's so fucking hard, right? Leading up to it. It's the worst possible time. Even though it's sad and it's traumatic after it happens and you kind of drop it, and some people go silent, some people grieve immensely over that point in time. But I also think, and I say this lovingly and respectfully, but it's almost like a great relief has come because even though you've said goodbye to a friend, even though that family, something that you're incredibly compassionate and had a loving relationship with that whole time, the moment it's passed, it's kind of like, oh, thank God I got to let that happen and got to see them out, as opposed to the week knowing that it's coming and the days are counting down and you know you've got to do that horrible walk to the vet and so forth like that. It's so daunting to have to do it. As I said to Melanie and multiple other people who've lost their dogs recently who've been friends of mine or people who've listened and shared their story, I've said to them, the way that you did it was remarkable. The bravery that you showed and the compassion that you showed and the love that you actually showed that animal all the way up to the end, because we're talking about it. And I said, you need to be commended for what you actually do. Whereas we've had people that have come here before, they've dropped their dog off and they've rang us up and said, oh, we don't want to do the euthanasia of the dog. Can you do it for them? And they've left us in the situation where we've had to. You want to ring the person and say, hey, man, like this isn't the job of my staff to do this. We've actually declined it. Like people were saying, can you guys take care of this? So we said, no. Our staff grieve over this. They're animal lovers. These are young girls, average age of about 18 to 19 years old. It kills them when they're doing this sort of stuff. Like their job is looking after and caring for live animals. They're not in that stage where they're actually dealing with the end of life strategy of them. So it's a hard thing.
Going back to what you said about it's better to be
a month early and rather than a day late. I would agree with that in most cases. But say, for instance, if we were dealing with, for instance, with Ladybug, like a spinal injury or a contusion like that, a lot of information they're getting from their standard veterinarian care is, if you don't do the surgery, we need to put him down now. It's just not true. 90% of cases, it's now been proven that if they still have some little bit of sensation in their back legs, even the tiniest bit, 90% of them will actually recover without surgery, without anything. Just rest, anti-inflammatories, and quiet. There was a study done over in the UK. They just finished it up last year. There was 70-odd dogs, mostly Dachshunds, that were in that sort of scenario where they were paralysed, but they had a little bit of 60 had a little bit of sensation in their back legs. The other 30 didn't have anything. The group that had a little bit of sensation, 98%, I believe. I'll check that later on. But 98% of them recovered to the point where they're actually back to walking and bladder control and everything, just with the use of anti-inflammatories and rest. And the other group where they had no sensation, it was about 50%. So over the whole, it was really encouraging to see, just with rest and management, there's actually a really high chance that can improve. Add that with acupuncture, with infrared laser therapy, very specific types of chiropractic treatment. I definitely would not recommend manual adjustments in those cases at all, but there are specific techniques we can use, all trying to stimulate the nerve activity through those back legs. Over that period of time, it can make all the difference in the world. So when they're given that option, when they go to the vet, we need to put this dog down or cough up 20 grand for the surgery. Not everyone has that money. Not everyone has insurance. So there's so many people out there that feel like, well, that's it then. I'm going to have to make the call. Whereas in a lot of cases, give them time, give them rest, a little bit of TLC. And if they've got the time to put into it, because it's not easy, Glenn, you know that. You know it's hard to get them back. There's a lot of sleepless nights. There's a lot of cleaning up. There's a lot of work there. But if you're willing to put the effort in most cases, they'll come back. Trust me, it's a part-time job.
Yeah.
For Narelle and I, especially in those early times, it was around-the-clock care where we were shift sleeping just to look after her and just to make sure things were going all right, because it was so touch and go for a period of time.
Yeah.
Mate, we've talked injury. Let's touch illness. Is there any illnesses that you do treat, or is there any illnesses that present as an illness but are actually an injury that people could be aware
that's a good
of?
one.
Let me think about that one. An illness that could be an injury. The tricky ones are normally the ones that look like a limp, but it's actually their spine.
Right.
We see that a bit with either their front legs or their back legs, where they've had this lameness for months and they can't work out where the problem is. The vets are really stumped and they're just not really sure what's going on. And in a lot of cases, it's a compressed nerve either in their neck, which is then affecting their front legs. So they're getting like neuralgia or pins and needles in their feet. And so they're limping on the foot, but it's actually coming from the neck. And same with like if there's an injury to the lower spine or the sacral area in the pelvis, which is around where their hips are, but it's in the back. There's a whole bunch of nerves in that area. One of them is the sciatic nerve, which runs down the back leg. Now, if that nerve is compressed, it really hurts. So then they'll have a tendency of limping on that leg. You can be looking in all the joints until the cows come home, but there's nothing there. It's actually around the nerve. So treating those specific areas is, it's a very different type of technique than treating a joint. So say, for instance, if you're treating a cruciate ligament injury, which I also see a lot, arthritis, there's very specific treatments and supplements that you use to help repair cartilage tissue and increase the fluid that's in the joints and trying to reduce swelling in the joints. If it's an issue in the spine, it's a very different treatment altogether. We use different supplements. We use things to stimulate collagen production rather than cartilage production. We focus on getting swelling down in the ligament tissue rather than actually in the joints. So all these sorts of things make a difference. And a lot of times it's mistaken, many, many times. Illness-wise, sure, we can treat all sorts of various things, everything from diabetes to behavioral issues. That's probably one thing that's probably of interest is the behavioral issues. A lot of things get diagnosed with bad behavior. In a lot of cases, it's just they're in a lot of pain.
Yeah, they're irritated dog.
Irritation and inflammation, it's incredible what it will actually do to behavior.
Yeah, absolutely. So I've seen huge turnarounds with dogs that are just not happy. And you go to touch them, they're trying to snap at their family owners, the kids and so forth. And we deal what the issue is, and it's usually a back issue or a leg problem. And usually they're back to normal within say 4 to 6 weeks, and now they're back to normal. They're not snapping at anyone. They're able to go to the dog park and all that sort of stuff. So that's probably the one that's most diagnosed is behavioral issues, but it actually turns out to be pain.
Yeah. We've discussed this many times, like with aggression cases, that's got to be one of your first questions is like, how healthy is the dog? Like, is it just that he's pissed off that he's in pain nonstop? Because this might not be an aggression issue.
Sure.
Like, sure, it's an aggression issue, but this could be a totally different fix.
Yeah, absolutely.
I think we've talked about that on an earlier episode where I had a client present in there with an aggression issue, and the conversation I'm now having with people as part of the diagnosis is, what are you feeding your dog?
Yeah.
What's the diet consist of? What is the poo like in the dog and stuff like that? All questions that Narelle's trained me in. This particular dog, they were saying, it's a kibble-based diet. And I said, look, before we actually do anything and we make any sudden movements on anything else, can I just suggest that we do a little bit of diet change and supplementation? They kind of looked at me like, I'm not this woo. And I said, just humor me.
Yeah.
Just humor me. Just give it a go.
Yeah.
2 weeks later, dog came back in. They said, what have you done? And I said, I didn't do anything. You did all the work. All I did was have a conversation with you. And they said, dog's entirely different. It's not barking at people now. It's resting. It's sleeping through the night.
Sure.
And I said, the same happens to us.
Yeah.
When we're feeling irritable, when we've got inflammation, when we've got illness due to poor diet, lifestyle things. I said, I'm exactly the same. I said, I am my own worst enemy with this. I said, Narelle teaches me all this great stuff and I ignore her when I get stressed. And then I feel like shit. And I said, but when I follow her programs, mental fog goes, clarity comes back.
Yeah.
Everything that she promised me I will start feeling, it all happens through good diet, nutrition. I said, it's not the solution to every single complaint.
Yeah.
But it's part of the remedy of longevity in some of these things. I think sometimes they say seeing is believing. And when you see these sort of things yourself and you just say some holistic therapies, some massage, some manipulation, some acupuncture, some dietary change and so forth, why the hell would you not consider it?
Yeah.
It's peer-reviewed science. Why the hell would you not? I think we've had a reign of, like I said before, pharmaceutical companies. Yes, they do good stuff. And yes, some pharmaceuticals are beneficial, but they're also like massive shareholders and multiple trillions of dollars that are trading hands. It's a stock commodity. There's so many wealthy people through them. Like there's a big market to push them and consume it and get it across the globe. So naturally, when there's cheaper alternatives and things that they don't have powers on,
Yep.
of course they want to block it, and of course they want to make you look like you're a conspiracy theorist and
Yep.
that you're a crackpot and a loony and stuff like that. But shamans and people all throughout history who didn't have access to modern science, not that I disbelieve it, but all of these people were healing people, were stopping illnesses, were stopping fevers and so forth by using alternate remedies that have been around for millions of years of humanity and people sharing a space with animals before. The remarkable part that people won't listen to it and won't take it into account because some marketing team have done some incredible work and convinced you otherwise. I get it.
Yeah.
I'm prone to marketing myself. I get stuck on some shiny things from time to time, but also when I'm around smarter people, I'm prone more to listening these days myself. So great work, Neil.
Thanks, mate.
Matt, I feel like we could probably talk about this stuff for hours, but I must go train dogs.
Yes. Right. We're past our allotted time.
First of all, thank you for being here. I appreciate you coming.
Absolutely.
But tell us, how do people see you? Like, you're based in Sydney, Western Sydney, so people who are in Sydney can be a client if they want to. And do you have anything for people around the world? What can you offer?
So I guess at the moment I'm just kind of a one-man band in Sydney for what I'm doing in my clinic. I've just recently kind of expanded into producing some very specific supplements for specific problems.
Okay.
So I've determined that, there's really nothing out there for spinal injuries, nothing specific for dogs that covers the health and well-being of those intervertebral discs. So I've developed a formula which is specifically for these conditions and needs. I'm really proud of that one. That one seems to be really effective.
What's it called?
It's called Spinal Health. It's a company that we started called Canine Vital. So they can find that online on caninevital.com.au.
And is that for someone like maybe you've got a Frenchie or a Dachshund that is potentially like a carrier of that issue you discussed?
Sure. Yeah. So
that's a good preventative.
Can be a preventative as well.
Okay,
so
cool.
it can be like specifically I developed it specifically for Frenchies and Dackies that have this issue, both as a treatment but also as a preventative. But I've also found it extremely good for, say, for instance, active dogs that you're trying to keep strong and trying to avoid spinal injuries. It seems to be really good as a preventative, whether it be for working dogs, agility, flyball, racing greyhounds, but also for the little fluffy fifis that are jumping up and down off the couch all day. There's a lot of pressure on their spine. So having something like that specifically for strengthening the back, I found really helpful. Because the things that we use to strengthen the spine are very different to things that we use for protecting and strengthening the joints. There wasn't really anything out there for spinal issues. So I devised that one and it's been working really, really well with clients. And so, we've just kind of recently launched that online so they can have a look there.
Awesome.
Outside of that, going forward, I'm pretty convinced that the skills that I have for helping to determine where an injury is, I'm pretty confident that's teachable. So I'm kind of in the process of working through how I'm going about that, but keep an eye out. I'm going to be putting out some free videos out there for information for people to actually know how to check their own dog for back pain.
I think you should have a Neil Barnsley College.
Mate, I've been thinking that the whole time you're talking. I'm like, how can I talk this guy into letting me film some content and selling it for him? Because I think like even just like a warm-up video.
Sure.
You know what I mean? Like how, because there's a market for that. There's some good greyhound ones that I've been through and had a look at that. But even just
how to stretch your dog.
Yeah, well, because, mate, we get our dogs, the dogs are in the car, we get them out. I tell people, warm him up, right? Like, don't come straight to the car to the field. But I don't know what to do. I just go, warm him up. And like when it's my own dog, I play the ball a little bit.
Greyhound people stretch their dogs and warm them up before they put them on the track.
Fucking oath. Yeah. So something like that, like there's a market for that for sure. On just how to prevent injuries, that sort of thing.
Yeah, combination of just going over and examining your own dog, checking for injuries, but also getting them used to it, and also you getting used to how your dog is supposed to move. How far does his wrist normally go? And then when something that happens is a problem, you go, oh, actually, that should flex more than it is. Maybe there's a problem here. And then look out for the cues. You see him licking his lips and maybe we've got a problem. These sorts of techniques, I'm looking forward to helping people get educated in that in the future. It's just finding the time.
Yeah. Well, maybe we can organise to get you back, because like some of the things I did want to touch on today was just how to identify injuries, like how to do some preventative stuff, things to be aware of, things that you see in certain spaces that you can count on. If you do a lot of this is what you're going to get from the dog, that kind of stuff,
For sure.
Be great to get you back to talk about that. And if you ever do have some sort of course to sell,
Yeah.
let us know, because I think it's a huge value to everybody.
Yeah, for sure.
We should get our listeners to ask questions and
Yeah,
put some
that'd be a
questions
good one.
together.
Yeah, I'd
and-
be happy to.
and
That'd be
talk
great.
about- do a bit of Q&A with Neil
Yeah.
Barnsley.
That'd be awesome.
Yeah.
Yeah. I
Yeah.
really enjoyed this. This is great.
Likewise, mate. Like I said, you're an asset that there's not a lot of you around. When you've got a local shaman in the area and getting to you is you're busy all the time and you're a long way out.
Yeah.
Like I'm saying, there's only one of you. So it would be great if you had a database of students that you're putting out there and,
Sure.
teaching other people how to do that. There's a good market in that.
That's the trick, right? Like everybody in your position I've ever spoken to, it's always a family affair. It's always, and I think we discussed it one time, it's a huge cost to you to train someone.
Time especially.
Yeah.
The time is the biggest cost. So if I was to train someone to do it properly, you're looking at 3 years.
Yeah.
Proper in-clinic experience, 3 years to really get your head around how to do this as a profession to the point where you can ask money for it.
And that's with a probably already health background, right?
Absolutely.
Like already
That's just learning the
knowing human stuff.
Yes, that's the diagnostics that we
Yeah.
were talking about earlier. It's just you need time.
Do you
just need
lecture on this? Do
repetition.
you get asked to go into universities and talk about this sort of thing?
Not so much. No.
Like, it's unbelievable that's not happening.
But there isn't a formal learning process for this here, right? So that would be why. Like there's no one to ask you, that there isn't a head of this
Yeah.
at wherever.
There was a University of RMIT down in Melbourne.
Yeah.
They used to have a course in animal chiropractic, but that folded a few years ago now. So there's really not much in Australia at the moment. So that's kind of why I had to go overseas to do the training. But yeah, going forward, it could be an opportunity. But I guess I'm more passionate about the educating and empowering owners
Yeah.
to be able to examine their own dogs. So they're not at the mercy of trying to get in to see a professional when there's like a 3 or 4 week wait. What do you do in that time?
that leads up to that point that Pat made before is a lot of people don't even know how to do basic stretches with their dogs to prepare them for an event.
Yeah.
The gentleman that I was discussing before, George Schofield, he gave me warm-ups for Harley, like how to stretch his back legs out, how to warm his muscles up. Because at that time I was in my peak trainability with him and I was, I was out on the field 3 or 4 times a week with him and we would be stretching our dogs. We were pulling their legs up, rubbing their muscles down.
Yep.
He'd give you a liniment to put on them and all sorts of things. And we'd do all that sort of stuff. As a result of that, I never saw another problematic injury from that again. But prevention's better than cure.
Absolutely. Yeah, it makes all the difference in the world.
It does.
Thank you for being here.
My pleasure.
Thank you, mate.
This has been great.
Likewise.
Let's do this again.
Please.
For sure.
Yeah.
All right. That's it for another episode, Canine Paradigm. We made it to the end.
Yeah.
If you like what you hear, like, rate, share, subscribe. Wait, how do people find you?
Oh, yeah.
We didn't tell people how people find you.
Go to our website, animalholistictherapies.com.au, or just go to caninevital.com.au and just click on the clinic link.
Perfect. All right. Back to my wrap up.
Yep.
That's it for another episode of the Canine Paradigm. As always, if you like what you hear,
Yeah.
like, rate, share, subscribe. Do that through whatever subscription service you download us from, and then just go to another one. They don't check. You can do it as many times as you want. If you want to support the show, best way to do that is to jump into Patreon. A few bucks a month gets you a giant backlog of information as well as new stuff going forward.
You haven't even talked about people getting earbuds stuck in their ears because I wanted to ask Neil what he would do if somebody just walked up and stuck an earbud in his
Well,
ear.
it is true. The very best way to support the show is while you're listening, just pull one of your AirPods out and just cram it in the person on the bus next to you.
How would you feel about that, Neil? If somebody just walked over to you and stuck a
Like, you got to listen. This guy
a
can fix
waxy-
broken backs. You got to listen to this.
As long as there was something that was mentioned about why he was doing it, it's like, you're invading my space, buddy.
All right, another one. Jump into the link in the description. Get in a spring. Get a T-shirt
Have
or
you
a
got a
wall
tapestry?
tapestry. We got to get you a tapestry for the
You need a Canine Paradigm tapestry.
Oh, that'd be awesome.
in your tiny little room. Have a giant. All right, so do that. And if you want to get in touch with that, the best way to do that is to jump into the Facebook discussion groups. 11,000 people in there, all being cool to each other. No dickheads allowed.
Yep.
But if you want to get in touch with us directly, shoot us an email. We are info@thecanineparadigm.com. Hope your dog lives forever. Goodbye.